All RNs working in palliative care or hospice settings should be required to participate in the procedure of medically assisted death. Changes to the criminal code in Canada came into effect on June 17, 2016, when Bill C-14 was approved, making it legal for Canadians who meet specific criteria to be eligible for assisted dying in Canada. Bill C-14 includes safeguards for both patients and healthcare workers, making it safe for nurses to partake in the process of assisted dying. As presented in my debate, nurses are essential to the process of medically assisted dying for patients and play a vital role. Nurses are available to help both the patient and the healthcare team during this difficult time for all. The role of the nurse is not administering the medication to cause death, but to assist in many other ways when managing the patient's care along with the physician or nurse practitioner during the procedure of medically assisted dying. Patients deserve the right to die with dignity, on their terms when they are ready. Patients should have the choice to either die at home with family, in their own bed, versus the need to be hospitalized or die in an unfamiliar environment. In either location, nurses play an important role in making the experience as comfortable as possible for all involved. This is Jane. Jane is a nurse and she's required to provide a level of nursing care to her patients. There are many roles that Jane can take on during the process of assisted dying. Some of these roles include talking with the patient to uncover the reason for wishing to die, educating the patient about legal requirements, being familiar with the procedures and institutional policies, discussing alternative means with the patient and family, participating in decision-making processes, preparing the medications, providing emotional support to families and colleagues following the death, and the list goes on. Nurses have a skill and knowledge that are essential for assisted dying. Experience in palliative care and hospice care allows nurses to bring their expert skill sets to the setting of assisted dying. As a nurse, our colleges and governing bodies require us to provide a specific level of care to our patients. The College of Nurses of Ontario states that it may consider abandonment if a nurse refuses to provide nursing care to a patient, and this can include patients who request medically assisted dying. In closing, the right for the patient to request a medically assisted death is now law in many provinces in Canada and many different countries around the world, as nurses are bound by professional obligations and duty to provide safe and ethical nursing care, with the focus being on the patient's well-being. Nurses have skills and knowledge to ensure that the procedure of medically assisted death is accomplished successfully. And as a result, nurses working in palliative and hospice care should be required to participate in the procedure of medically assisted dying within the capacity of a nurse. Thank you.